The Vice President, Mr. John Mahama, has opened the Sweden-Ghana Medical Center at Accra near East Legon in Accra. The center will offer specialized treatment and care for cancer patients. It is one example of public-private sector initiative, with the center being the most equipped cancer treatment center in the whole of the West African sub-region. Napoleon Atiquito reports.
Cancer cases are growing in sub-Saharan Africa, Ghana being no exception. The responses are varied, but the goal is the same. The government has been equipping the teaching hospitals to be able to handle the ailment capably. The additional intervention comes from the private sector. The Sweden-Ghana Medical Center, located in Accra to deal with cancer cases, is being financed by global medical investors of Sweden and some Ghanaian investors. The center boasts of highest standards in cancer care and treatment. It will serve the sub-region and beyond. The inauguration of the center was blessed with the presence of the Vice President, Mr. John Dramani Mahama, former President, Mr. J. Kufuor, and Lady Julia, wife of the Asantehene. SGMC, as managers of the center prefer to call it, will offer important services in cancer care, radiotherapy, chemotherapy, pain control programs, and psychosocial support. In addition, there will be cancer prevention and patient education programs. In the near future, a patient hotel and a more advanced radiotherapy with IMRT are to be added to the existing facilities. One thing about SGMC is that it seeks to demystify cancer, one of the most feared diseases, as any normal medical condition which is curable if detected early. The board chair of the center is a Ghanaian, Henry Bruni Amponsa. The chief executive officer is Thomas Polare, a Swedish.
We all have to be part in the education information to the general public that early discovery of cancer dramatically improved your chance to be cured.
Sad as it may be, people continue to die due to lack of finance and other traditional beliefs. We are inviting all of you to be part of SGMC's mission of educating people and providing the necessary funding, especially our Ghanaian patients and our brothers and sisters in the West African sub-region.
The Vice President, Mr. John Dramani Mahama, said changing lifestyles and modernity could be the additional factors responsible for the increasing rate of cancers. He prayed that the Sweden-Ghana Medical Center will become an effective partner to concurrent efforts by the government to deal with the problem.
With this center, it means that it will no longer be necessary for people to bear the high cost of traveling to Europe or South Africa or other places to receive cancer care. Cancer care will be available right here in Ghana and at an affordable cost, more affordable than you can treat it in Europe or in any other destinations.
Just recently, the Swedish envoy based in Abuja, Nigeria, Mr. Per Lagarde, and the Honorary Consul of Sweden in Ghana, Mr. Makaya Matefio, paid a courtesy call on the Vice President, Mr. John Dramani Mahama, to announce further plans on medical cooperation. The Sweden-Ghana Medical Center was obliged with the shortcut by the former President, Mr. J. Kufuor, with his various stages of development under the watch of the Mills administration. Napoleon Atiquito, GTV News, Accra.